This is Professor Wick from RN2 Professors with an NCLEX question review for you on normal pediatrics growth and development, focusing on toddlers. There will be a link to the playlist for the other developmental age groups at the end of the video. Stick around because I'm going to walk you through several questions and their rationale to help you better understand the material and how to apply it for your exams. When studying for pediatrics growth and development, there's a few topics that you need to review to help you answer the questions. Erickson's psychosocial stages, developmental milestones, child and adolescent immunization schedules, and child safety. To get these tip sheets and other free downloads, join us on our Facebook group. Follow the link displayed to get there. Which statement by the mother of an 18-month-old would lead the nurse to believe that the child should be referred for further evaluation for developmental delay? Number 1. My child is able to stand but is not yet taking steps independently. Number 2. My child has a vocabulary of approximately 15 words. Number 3. My child is still sucking his thumb. Number 4. My child seems to be quite weary of strangers. The age of the child is key to answering this question. Knowing the basic developmental milestones for an 18-month-old will lead you to choose the appropriate intervention. Review the milestones and look at the options again. Number 1. My child is able to stand but is not yet taking steps independently. Number 2. My child has a vocabulary of approximately 15 words. Number 3. My child is still sucking his thumb. Number 4. My child seems to be quite weary of strangers. The correct answer is number 1. The child should be walking independently by 15 to 18 months. Because the toddler is 18 months old and not walking, a referral should be made for developmental consult. All the remaining options are common for an 18-month-old. A 2-year-old admitted to the hospital 2 days ago has been crying and is inconsolable much of the time. The nurse's best response to the child's parents, who are concerned about this behavior, is that the child is in 1. Detachment phase of separation anxiety. Number 2. Despair stage of separation anxiety. Number 3. Bargaining stage of separation anxiety. Number 4, protest stage of separation anxiety. As you can see, based on the options, this question is about the stages of separation anxiety. Watch for distractors in this type of question. In the options, if there are stages or steps, many times several of the options will be correct stages or steps, but not the correct one for the scenario that's in the question. Read the answers through again and decide which one is correct for this scenario. Number 1, detachment phase of separation anxiety. Number 2, despair stage of separation anxiety. Number 3, bargaining stage of separation anxiety. Number 4, protest stage of separation anxiety. The correct answer is number 4. During the protest stage of separation anxiety, children are often inconsolable and often cry more than they do when they're at home. These children also frequently ask to go home. The other options are incorrect for the following reasons. 1 and 2 are stages of separation anxiety. However, these are your distractors. That is because they don't fit the scenario. In the detachment phase, the children are usually cheerful and lack a preference for their parents. In the despair phase, children can have a loss of appetite, sleeping problems, and no interest in play. And then in option 3, that is not part of the separation anxiety, that is a stage of grief. According to developmental theories, which important event is essential to the development of the toddler? Number 1, the child learns to feed self. Number 2, the child develops friendships. Number 3, the child learns to walk. Number 4, the child participates in being potty trained. This question is based on Erikson's psychosocial development and is referring to what is important to toddler development. As you read through the answers again, use that knowledge to pick the correct developmental goal. Number 1, the child learns to feed self. Number 2, the child develops friendships. Number 3, the child learns to walk. Number 4, the child participates in being potty trained. The correct answer is number 4. Developmental theorists, such as Erikson, believe that toilet training is the essential event that must be mastered by the toddler. Option 1 is incorrect because although toddlers do like to do everything for themselves, potty training is still the most important in their development. Option 2 is incorrect because toddlers engage in more parallel play than they do in friendship building. And 3 is incorrect because walking should be mastered by 18 months. Which comment should the parent of a 2.5-year-old expect from the toddler about a new baby brother? Number 1, when the baby's taking a nap, will you play with me? Number 2, can I play with the baby? Number 3, the baby is so cute, I love him. Number 4, it is time to put him away so we can play. For this question, the toddler's response is based on their stage of psychosocial development. The key is the age of the toddler. While reading the answers, choose the correct statement from the toddler based on their developmental phase. Number 1, when the baby takes a nap, will you play with me? Number 2, can I play with the baby? Number 3, the baby is so cute, I love him. Number 4, it's time to put him away so we can play. The correct answer is number 4. This is a typical statement that would be made by a toddler. Toddlers are very egocentric and do not consider the needs of the other child. The other answers are incorrect for the following reasons. Since toddlers are egocentric, it is not likely that they'll wait to play with their parent. Toddlers also are more generally involved in parallel play and don't engage in play with others. And finally, toddlers usually initially resent the presence of new siblings. That's because they take away some of the parent's time and attention. Which stressor is common in hospitalized toddlers? Select all that apply. Number 1, social isolation. Number 2, interrupted routine. Number 3, sleep disturbances. Number 4, self-concept disturbances. Number 5, fear of being hurt. The key to answering this question is the child's age, their developmental phase, and common stressors that affect hospitalization. Remember, this is also a select all that applies question, so treat each answer as a true or false to the question. Don't group them together. Read through the answers again based on this knowledge. Number 1, social isolation. Number 2, interrupted routine. Number 3, sleep disturbances. Number 4, self-concept disturbances. Number 5, fear of being hurt. The correct answers are 2, 3, and 5. Interrupted routines, disturbed sleep patterns, and fear of being hurt are all common stressors for hospitalized toddlers. The other answers are incorrect because they are stressors related to hospitalized teenagers. That's it for this review. Thank you for joining me today. If you like this video, check out the others in the series and click like, subscribe, and the bell to get notified when new videos are posted.